Hi everyone, welcome back to my channel. So last week I made a video on a day in the life of a physician, and it was during my orthopedic surgery rotation. And a lot of you were really confused of why are you in family medicine and still doing rotations or still doing specifically surgery rotations. I had a lot of questions and everyone was really confused, and so I thought I'd make its own separate video explaining what residency is, because I feel like a lot of us only see it on like Grey's Anatomy and stuff like that, so the reality of it is kind of skewed. So as a resident, I do get paid a salary. It's very small compared to the amount of hours I work, but it's a salary. So basically it doesn't matter if I work 40 hours a week or 100 hours a week, I still get paid a set amount. And what residency is basically your training. So family medicine residency is 3 years. I have the option to do fellowships after the residency, say like in sports medicine or high risk deliveries, emergency. I can do all of those with an additional fellowship. That goes the same with orthopedics. So there's general orthopedics, and then after that people do fellowships in upper extremities, in replacement, in sports medicine and stuff like that. So my whole month of orthopedic surgery rotation includes outpatient surgery and sports medicine. So you guys will see those videos later on this month and next month. So family medicine, you get trained for 3 years basically as a junior physician, and then after that is when you become a real physician. Basically, you don't have to report to anybody, you can start your own practice, you can work in a hospital group setting and get paid a real salary. So I guess you have to think of it specifically for family medicine. What kind of patients do you see and how do you get trained in these aspects? As a family medicine resident and family medicine in general, you see everything and you take care of everyone from birth until death. And so that's why I had a pediatric rotation, because I'm going to see pediatric patients, and who to learn better from than pediatricians. People ask, why would a family medicine resident need to go into orthopedic surgery or learn from an orthopedic surgeon? And you guys haven't seen this yet, but outpatient wise, when the surgeon is not in the OR, he's in clinic, and there are many things that I feel like relate to family medicine. I got really good feedback and was taught how to do steroid injections in like the knees, the elbows, the shoulders. What other person better to learn from than someone who was trained and did this millions of times? Botox, for example, yes, it's used for like wrinkles, to prevent wrinkles and to shape the eyebrows and stuff, but another use for Botox is actually headaches, tension headaches. And so as a family medicine doctor, that's in my scope and realm of practice, and who better to learn that from than a plastic surgeon? Going back to orthopedics, they learn a lot of casting, or they do a lot of casting and fractures of the humerus, like things like that, like things that a family medicine as a family medicine physician you can take care of, and it's good to learn those things. And especially if you're working in urgent care or emergency, those are all good things to learn. So for me specifically in my program, we rotate through different rotations, either 4 to 2 weeks, and once a week is continuity clinic, which is I see my own patients, where it's the typical family medicine outpatient. Just to list some of the rotations that I'll be on this year is, you guys saw pediatrics, geriatrics, orthopedics, sports medicine, surgery, cardiology, internal medicine, inpatient, night shifts, emergency medicine, women's health, which is labor and delivery. So I'll still be rotating through all of that. And that's what's so great about family medicine, is because I can still do all those things. Later on in my practice, if I still want to deliver babies, I can still do that as a family medicine physician. If I get the numbers, if I deliver enough babies during my if I deliver enough babies during my residency, then I can still do that as a family medicine physician after residency. If I do enough steroid injections, if I feel comfortable doing that, I can do that on my own after, on my own when I start my own practice or once I start my job. And so I feel like this is your training basically, and I'm still going to go through different rotations because that's how as a resident you learn. And what's different between residency physicians now compared to third and fourth year med students is I am responsible for these patients. So say as a third and fourth year, you may be able to go into orthopedic surgery and you may be able to go in and learn from the physician during clinics and stuff, and you may be taught how to do the injections. But as a resident, I am doing the injections, I am making the plan, I am telling the patient, what to do, when to come back, prescribing the medications and all that stuff. And the doctor is signing off and saying, okay, I agree, or okay, I don't agree, maybe you can switch this, and then I'll agree. It's the same setting, but more intense and more responsibility if you look at it that way. So far, I really enjoy what I'm doing. I love family medicine, especially for people who love everything and can't figure out, like, I want to do this one thing forever. I think family medicine, it touches base on everything, and it's amazing to watch families grow and see new life and go all the way till geriatrics or in death. It's an amazing feeling to take care of these people and to be able to learn all these different things. Yeah, so rotations are every 4 weeks. Radiology is 2 weeks, ophthalmology is 2 weeks, and you think, why does a family medicine doctor have to learn radiology? And that's important too, because people are going to need imaging. I'm going to have to work in the hospital, and it's good to be able to read your own imaging that you order, So doctors, I can't even emphasize this enough, but family medicine, you have to be so well-rounded, and the best way to learn are from people who specialize in that area. And if you think about it, family medicine, it's really important to know these things, is because you don't want to just send everybody out or refer everyone out to a specialty. Everyone, if you've ever tried to get into a dermatologist or tried to get a referral anywhere, it's really hard and there's a long wait list. If there is something that I can do for you and that I can take care of for you in my office, then I would rather not have to send you off somewhere else where you might have to wait longer and you might have to pay more. So say like you have moles that you want to get checked out or looked at, if they're benign or malignant, like, I think that as a family medicine doctor, I should be able to tell you those things. And if something is concerning, then I would refer you over to dermatology. But I should still be able to biopsy that lesion for you. I should still be able to give you your options. Like, I should still be able to take care of you as a patient. And then when I feel like I no longer can help you, then I will refer you to dermatology. But the only way I'll be able to do that is if I'm knowledgeable, if I know what I'm looking at, if I know what I'm doing. And so just think about it this way. The scope of practice for family medicine, you can work in emergency, you can work in urgent care. So the scope of practice is very big. You can deliver babies, you take care of geriatric patients when they're dying, when they have chronic diseases, and then you take care of babies when they're just born. And so I'm going to be rotating through all those things. I'm very excited about this year. I'm excited to learn and have more responsibility as a physician, and I hope that explains what family medicine, specifically residency, is like. Obviously surgery residency is different. You'll probably have like 1 month of medicine because you'll still have to know medicine, like internal medicine, but the rest would mainly be surgery and different types of surgeries, like vascular surgery, cardiac, like all the different types of surgeries. So I can't speak on their behalf, but just to give you a sense of what family medicine residency is like. So if you haven't already, subscribe to this channel, don't miss an upload, and continue to see what residency is really like. And obviously you'll see more of Wyatt growing and stuff like that. So yeah, I hope you guys enjoyed this video. If you have any questions that I haven't answered, please leave them in the comment section below and I'll be sure to get to them. If you haven't already, please subscribe and I'll see you guys next time. Peace. Let's go see Wyatt. I can only do this when he's napping.